This episode of eHealth Radio is brought to you by uNatural, empowering your health. No matter the season or reason, Breathe by uNatural makes it easier to do just that. Our super simple, no-nonsense formula helps improve the function and health of your lungs naturally. A time-tested supplement formulated specifically for sinus, nasal, and lung support. Breathe in. Enter eHealth 15 at checkout for 15% off at uNatural.com. Again, that's eHealth 15 for 15% off at eUNatural.com.
This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Dr. Bob Monteverdi, the Global Healthcare Solutions Leader for Lenovo Health at Lenovo. Dr. Bob is an executive and physician with over 3 decades of experience across business and healthcare. Dr. Monteverdi, thanks for joining us here today on eHealth Radio.
Thank you, Eric. Really pleasure to be here. Appreciate the opportunity to engage with you.
You're certainly welcome and certainly appreciate your time as well. So when we think about bigger picture in healthcare right now with all this going on, what products does Lenovo have and what do they mean for healthcare providers and patients?
Sure. We can go on for a while about that one. We're in thousands of hospitals with top quality hardware, as I'm sure you're aware. We make everything from ThinkPads and clients right on up through the most powerful servers, and along with services organization to stand behind all that. So pretty large global entity, as I know most are aware, but we also focus pretty heavily specifically on healthcare. Thousands of hospitals have our hardware, but my role here and my mission and passion is really to drive more strategic solutions from Lenovo into the healthcare space. And what I mean by that is leveraging the strengths that we bring to the table, but adding in through internal development and partners, software, services, and additional elements that make true solutions that can improve healthcare. So while we have that array of hardware, we've really been focused heavily on starting to roll out different solutions from a virtual healthcare perspective. That's kind of our strategic play here, and there's multiple components to that, but that's the path we're going down. I can get more specific, of course, as we go through some of our Q&A back and forth here.
Sounds like a plan with a truckload of products and options for sure. Now, is virtual rounding a solution that will still be relevant after the COVID-19 pandemic has subsided?
Yeah, I think everything in virtual health, including one of our offerings, virtual rounding, will be relevant. COVID, we've been working on virtual health, and that's the overarching banner. Within virtual health, we've got a couple of offerings, virtual care, virtual rounding, a couple of additional offerings beyond that, and we're also looking at the life sciences space for virtual trials as well. But, you asked about virtual rounding, and, COVID and the pandemic, as you allude to, a major impact globally, of course. And that really became two factors. It became a catalyst to have us take a little bit of a step back and say, wow, we're focused on this large virtual care play with, and we'll get into that with remote patient monitoring and behavioral habits and assistive AI, but looking at the situation in healthcare with the trying to limit the expense of PPE, the shortages of this personal protective equipment as well, and then trying to limit infection spread, we didn't really want to have physicians and providers interacting face-to-face if we can help it. No one's looking for that. So the idea to have a really robust, internal, enterprise-wide, solid virtual rounding solution that physicians can interact with those patients that are in beds, that are hospital bound or inpatient at the time. That was really the catalyst for this, and COVID validates just the whole virtual care, virtual rounding, virtual health type of approach. But the long-term angle, clearly, even when one pandemic comes and goes, there will likely be more. This is not the first and not going to be the last. And then when you look at the efficiencies of this, the healthcare professional shortages globally, where we don't have enough physicians to take care of the population that's ever growing, I think we're absolutely talking about long-term plays for rounding, for care, for health, all these different virtual plays.
Definitely appreciate your input there as we look ahead. Now, a question for you that would help answer quite a few things and help listeners understand your company. So tell us, why Lenovo in the healthcare space specifically?
Well, we're a large entity. We think we can make a major difference here. We bring a lot of different strength to this. We've been ramping up in recent years internally with a set of really strong subject matter experts inside Lenovo. Not many people are necessarily aware of that, but that is absolutely the case. So we've grown our teams. We've focused on a couple of key industries. Education is another one, but healthcare is really a big space for us to really go after. And we feel it's someplace we can apply. You think of our strengths: 180 markets, global, 60,000 employees, strong supply chain, strong operations, strong logistics, back-end office operations. You combine that with right up front, strong subject matter experts in the space, the fact that we're in thousands and thousands of hospitals already, and you put that all together, and it makes a tremendous amount of sense for us to apply our expertise, our partnerships, our high-tech capability, and make a difference in the health of parties out there and patients. It's just it's an essential play. There's a noble aspect to being involved in healthcare. We've been participants for the last I think it's 5 years now in healthcare's big HIMSS conventions. We're Chime members that involve healthcare CIOs around the U.S. We've done presentations at Becker's and podcasts. And, we're really getting the word out there increasingly that this is a big part of our overall strategy. So healthcare is just really a natural for us, and our Lenovo Health division is pioneering that way.
And of course, on behalf of eHealth Radio, we really appreciate what you're doing in the healthcare space and the impact you are having through Lenovo Health at Lenovo. Now, the name says it all. Breathe UNatural's potent lung support supplement made by medical and herbal professionals makes it easier to do just that. Formulated for sinus, nasal, and immune health. Save 15% with eHealth 15 at unatural.com. Try it risk-free for 90 days with code eHealth15, again at unatural.com. Today we are visiting with Dr. Bob Monteverdi, the Global Healthcare Solutions Leader for Lenovo Health at Lenovo. He's joined us here today on eHealth Radio's Healthcare and Health News channels, a part of the eHealth Radio Network. Now, recently, Dr. Fauci warned that we might be seeing 100,000 new cases of COVID-19 each day. How does telehealth and virtual care help minimize these numbers?
You bring up one of my favorites, Dr. Fauci. I love facts and truth, and he's been really helpful in spreading that out to the world. There's a lot of things here that telehealth really helps with, and whether it's virtual care, virtual rounding. Think about, if you limit face-to-face, you do limit the infection spread. You do reduce the need for PPE. Those are the most basic benefits when you pull yourself away from the face-to-face interactions. But the ability to have information at your fingertips on a more recurring basis, more frequently, earlier in the cycle. These are all important to be able to maintain really good, strong early interventions, early warning systems. If you're talking, let's talk a little bit about our virtual care solution. And, COVID's underway. People are not able to necessarily even get to their doctors. No one's looking to put themselves in a position for more infection spread is how I would put it. So got a lot of issues with that. And when you do a lot of this remote type care, which is what this is really all about, first, it's definitely safer. Second, it's got the ability to really improve the outcomes of the patient on top of being a safety factor. It's a supplement to regular care. There are times you need to be face-to-face with your physicians and your nurses, of course, but if you can do more of these things remotely, get a better outcome through the stronger monitoring that's going on, improve and drive better patient habits in the process. And in the case of virtual type situations where you're not face-to-face, you can increase the geographical access and the patient reach. So there's lots of different ways this benefits, and there are more. There are reduced same diagnosis readmits, which hospitals get penalized for. There's this whole movement in the last 5 years in healthcare towards consumerism and patient centricity. So you think about more patient engagement, more patient satisfaction, greater patient reach, greater patient education, better HCAP scores internally. On top of all this, there are drivers. Being in healthcare all these decades, usually you need a really good reason to implement a technology. But on top of that, when you have a reimbursement angle or a government compliance angle, that actually helps too. And Centers for Medicaid and Medicare have actually been increasingly reimbursing for everything from telehealth basic e-visits right on through the kind of remote patient monitoring type solutions that we have, where you have devices in patients' home that can communicate data. So I can go on a long time on that answer, but I'll pause here, Eric.
And I know it's hard to stop speaking when it's so exciting and you're resolving a lot in the space, so that is always a good thing. Now, what results are you seeing from this type of care, speaking of telehealth and virtual care?
Yeah, you definitely increased patient satisfaction, engagement. With our virtual care solution, just describe it a little bit so you understand. Think about it as a Lenovo kit that has assistive AI type software, kind of the virtual care coordinator, virtual nurse that kind of prods you along a little bit, make sure you're taking your meds, doing your exercise, eating healthy, and then combine that in with the monitoring capability, hooking up blood pressure cuffs and glucometers and pulse oximetry to just monitor vitals for patients. And if anything is out of bounds or out of whack in terms of those levels, your provider is notified, if you will. Then there's patient education in the mix. So it drives habit formation, and we're seeing roughly 82% daily engagement with patients that utilize this. So it's you can't prescribe a habit, but the idea is, can we drive habit formation and better behavior by patients? Because we're all not the best necessarily in listening to every last aspect of our docs. The other thing you see is you tend to see decreased readmissions, and I alluded to it before. Hospitals do get penalized if a patient is discharged from a hospital, and depending on the actual diagnosis, if they come back into that hospital for the same diagnosis within 30, 60, 90 day windows, there's significant penalty, and often the penalty is you as a health system are rendering that care for free. You can't bill for it. So readmissions go down is another big driver here. And then lastly, just by virtue of the fact that there's so much self-management going on by the patients, in addition to the oversight and monitoring by the providers, you'll see glucose levels in a diabetic or blood pressures in hypertensive patients start to come down quicker, sometimes as soon as 4 weeks is what we've been seeing for patients utilizing these types of things. So it's there's an awful lot of benefits in addition to the ones I mentioned before that are a little bit more broader.
Dr. Monteverdi, really appreciate your joining us on behalf of Lenovo Health at Lenovo and all the information shared. Before you go in conclusion, any closing thoughts, a takeaway, a tip, or anything else you'd like to share with the listeners in conclusion today?
Oh, just that to make sure everybody understands that, I think about business in general. Everybody's involved in trying to provide value to their customers and in trying to grow their base and grow revenue and grow profits, and it's clearly a part of everyone's mission. But, for me, for my team, for people that have dedicated their lives into healthcare, it's that extra element that doesn't really exist in most other industries, and it's just that noble aspect that we can potentially improve the care that people get, make better quality lives, and we're limited on our time on this planet, but if we can improve it and get the best quality you possibly can during our time here, it's a wonderful, noble goal that I think we all share in this industry. So what we do is try and apply technology, just like a lot of other entities, and try to make it better for the providers on the hospital side and acute and ambulatory sector, as well as all the patients and their families. And that's what this whole thing is about. How do we make it more convenient? How do you make healthcare more convenient, more accessible, more effective, drive costs down, keep it secure, on and on and on. That's it, Eric, in a nutshell. Proud to just be a small part of it, and even prouder of the folks on the front lines that are we see on the news every day treating these patients. Incredibly brave and the heroes of our time. So thank you so much for the opportunity today.
You are certainly more than welcome. Our pleasure and honor to have you with us today. Tell us where listeners can go online and get more information on Lenovo Health.
Oh, just go to Lenovo.com and put in health in there, and you will find a wealth of our solutions. And contact us directly as well. We are here to serve.
Excellent. And we'll leave a link within the show notes of this broadcast to further help the audience as well. Again, Dr. Monteverdi, all the best. Thanks for joining us here today on eHealth Radio. Much appreciated.
Thank you, and stay safe and healthy out there, Eric.
And you as well. We've been speaking with Dr. Bob Monteverdi, Global Healthcare Solutions Leader for Lenovo Health at Lenovo. And for further details, visit Lenovo.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.
This episode of eHealth Radio was brought to you by uNatural, empowering your health. The name says it all. Breathe. uNatural's potent lung support supplement made by medical and herbal professionals makes it easier to do just that. Formulated for sinus, nasal, and immune health. Save 15% off with eHealth 15 at uNatural.com. Try it risk-free for 90 days with code eHealth 15 at eUnatural.com.